Hello and welcome to my podcast entitled David versus Goliath Adventures of a Pro Se Litigant. This is a story of a lawsuit being filed by myself, so I'm sort of the David guy, against my former employer IBM. So they are Goliath. And the path I've chosen is without any lawyer or counsel, so it's called a Pro Se Litigant. And that introduces a lot of interesting experiences. There I am. So I have improved a little bit over the first episode where I was using sort of hand visuals on a clipboard. Um, I want to give the legal disclaimer up front. I am not a lawyer. This is not any sort of legal advice that what I'm providing, and you should not take it as that. What it is recounting my experiences and sharing those for the benefit of those that either find them interesting or maybe in a similar situation that I'm in myself. So in the first episode, basically I did an overview and did a status of where we are, and I looked very carefully at some of the feedback that I got and thought that I'm going to change the theme of this episode to answer the feedback. And the main feedback that I got was there wasn't a very clear explanation of what is the discrimination, the specific discrimination action that IBM did, and so I thought I would take the time in today's episode to outline that in a lot more detail. I sort of had avoided the topic, thinking it's going deep in the weeds, but I'm trying to present it in a way that we can continue to follow it. I'm going to have to give another disclaimer because this is going to get into the topic of Medicare and almost medical insurance. And there is a business of brokers doing that, so I'm not a Medicare trained broker or professional. Again, these are my experiences and my views. A bit of a review of where I am in the timeline. So as you can see, I'm between the last two rows. I have filed the suit, and we'll get into more detail about how that all went in some later episodes. And right now I'm waiting for a response from IBM. I'm just going to show this without getting too close to too close. This is actually the from the public accessible court system known as PACER, and this is used by attorneys as well. And here you can see this is my actual civil complaint as filed. There's my name, defendant IBM, and these numbers here at the bottom with the number sign at the top, these are the numbers of actual file entries in the docket. So the first one is my complaint. I think I'm up to about 11 docket entries right now. There's the case number at the top. That's the way it could be searched. And there is the nature of the suit and 890 other statutory actions, and on the other side it has the name of the statute, ERISA, ERISA. So before we get into it, I think I just need to level set that we all have the same opinion of what Medicare does. And so this is a very simple scenario of, what we have medical insurance for is that we have a medical expense that's being charged at some rate, agreed rate, and it could be $100 primary care visit, or it could be, a multi-$1,000 hospital operation. And basically Medicare covers 80%, and then there's 20% left over for the end user to decide how to approach that. So one example is what's called Medigap, and in that case, again, if it's, let's say the bill is $100, then Medicare covers $80, and the Medigap insurance automatically covers. Well, automatically the provider has to request it, but the insured doesn't see anything, and they collect the other 20% from a Medigap insurer. Another phrase that's heard a lot is Medicare Advantage. And in that scenario, that total cost is covered by the Medicare Advantage plan, and whoever's doing that is doing Medicare under the covers on your behalf. This is a chart from the Medicare, the government Medicare website, to assist to explain some of the terminology that flies around in here. You hear a lot in terms of the different plans. A and B are your basic hospital and doctor visit. Then you have these flavors of C, D, F, G, up to N. I didn't even know all these. These are kind of tough to digest when you don't have to make the decision and to understand it, but one simple way that you could look at this without understanding the details of every row and what they mean is who's got the most green check marks. So F and then G have the most green check marks. These are the ones that are actually considered and often get called Medigap plans, which is what on the prior chart. And in fact, the one that I was enrolled in was called a Plan G, but I just sort of heard it as Medigap all that time. So I'm going to switch, and I clicked off the screen for a minute. I'm going to switch for a minute to explain how I built this chart up and what it actually means. So the issue has to do with a certain type of health fund which IBM created for a certain number of retirees, not all. And then in the summary plan description, which is either a hard copy or an electronic document, and I have two versions, one from 2020, one from 2023, it describes the administration of this benefit. So the section that talks about how do you, enroll, apply for the healthcare reimbursement arrangement is lengthy. It can push 3 to 4 pages. And so what I've done in this chart is summarized it. What's the language there, so it's easier to digest what exactly IBM is doing here. So let's go back to that chart. And you can see at the top is the actual EEOC charge number where I filed the charge with the EEOC. So the rectangular block at the top represents all the HRE eligible retiree population. And I would say that's in the multi-thousand. Not sure if it's in the tens of thousands, but it's a pretty big number. And what IBM is basically requiring of this group, certainly the ones on the left side where it says specific plan purchase required, is in order to access their funds, they actually have to enroll in a medical insurance plan through the vendor. This is the 2020 version, through the vendor via benefits. And so this is what I did, was I called via benefits back in after I retired at the end of 2020. Okay, I said, where is my money and how do I access it? And basically, first they said they had to enroll in a Medicare Advantage plan. The choices for that in that very first block at the left were probably the 20 or 25 that are sold by any insurance broker and you see advertised on TV in the enrollment period at the end of the year, Mutual of Omaha, AARP, etc. But the one that I was using, the Medigap plan, was not in the list. So I expressed that to the fellow on the phone. And what he said was, okay, you don't need to necessarily do that one. If you just enroll in a drug plan, which is the middle one there, and there's specific plan purchase required. That's what I did. And that's that was sort of an inconsequential change to how I cover things. Basically, the prescription drug plan that I had already selected was available from via benefits. So it was just, enroll through them. And so everything was good for the next 2 years of being able to access my HRA funds. I'm not going to mention the Medicaid at the moment until we progress to the next version of the SPD, but what was very peculiar in that document is that there were 3 categories of retirees that were exempted from enrolling. And they were someone who was living outside the USA, a military history, in other words, they have TRICARE for insurance, and mentioned Kaiser Permanente. So really reading the plan, it looked like, at first I would have said, gee, I don't know why IBM requires us to enroll in this plan through them because I could do it, outside and still get funds. But anyways, oh, look at this. And it's not everybody. There's some they exclude. So there's no explanation of this special consideration category. So I mean, I sort of have a reason behind it, but there was none that IBM offers in the description and none that I've seen in any documentation. So that was the status as announced January of 2020, as I retired in October of 2020. And throughout 2021 and 2022, I was able to access my funds, process several claims. Towards the end of 2022, communications were coming out, not as an official letter. It seemed more like, body language and, hey, look at this FAQ or whatever. But they were going to be basically getting rid of VIA benefits, moving to different vendors to manage this. And actually, it was a combination of a healthcare and a bank. So United Healthcare and Optum Bank. And they started to jiggle around the top row there of the subcategorization as well. So let's have a look at that now. So the interesting thing, the first thing that I really noticed was that they added a new category of special consideration, Medicaid. And I understand that very well, why they did that, but it was interesting that it was avoided in 2020. So I would say that group was discriminated against at that time, that they did not have an option to get their HRA. And what they would have had is what I'm currently facing, whereas you can see what they did was they got rid of this prescription drug option, and they're pushing everybody in the plan purchase required category to buy one of two plans through United Healthcare. When that occurs, you can only be enrolled in one Medicare Advantage or Medicare Gap plan at a time. This is a Medicare requirement. So if I were to enroll in the United Healthcare plan, which IBM is pointing me to, I would be unenrolled in my current Gap plan, my Medicare Gap plan, which was the category I had in, and to go back to it is a whole reevaluation of pre-existing condition. One of the benefits of enrolling in those plans at the time of initial enrollment is, let's say right at the age of 65, is you get in there at the lowest premium rate and there's no medical examination. If you drop it and try and drop back into it 5 years later, there's a medical reevaluation. So there's really no guarantee on whether your premium prices are contained. So this becomes a big impact on potential annual cost and coverage. And in fact, it's enough of a big impact to me, and I know several others, that they refuse to take the new plan, and basically their funds are blocked. And for some reason, Medicaid, who would have had that problem, because Medicaid would also be disenrolled if they enrolled in the Medicare Advantage plan, Medicaid was also given a pass. So when I look at this chart, this actually is also how I made recommendations to the plan administrator about how to, in my two letters. In the second one, I said, here's an easy way to solve it. Is, those names that are in the special consideration category, they get a special check mark, because when they go to Optum Bank for a claim, Optum Bank is not going to say, hey, you're not enrolled and you can't get your funds. Optum Bank's going to say, oh, you're okay, right? You have the check mark for special consideration, so you can get your funds. Did you have to enroll in anything? Nope. Did not. And this is what my funds currently look like. It took a while till they appeared, but there it is. I said 20,000 the other day. It was 21,000 as of this date, which was back in around March, April. And you can see HRA perpetual dormant. So dormant means dead to me. I can't get to it. And so that is the punitive action that IBM has done to me and to many others. In other words, they were blocked from that fund. The other thing that I find a little bit upsetting is that I think during the period of the fall of 22 and the first quarter of 2023, they also communicated via, I'm going to say body language messaging, FAQs, the Facebook sites, which are actually not being managed by IBM retirees, but being managed by IBM itself, saying that if you did not enroll, you will lose your HRA funds. Well, you don't lose them, you lose access to them. Those funds don't just go away. So that was kind of a little fine print. And so I still have my funds there. I just can't do anything with it. And I did try to submit some claims. Let me just come back here. There I am. So that's the end of the visual slides. I had one other thing I was going to share before we close for this session. I hope that's been informative. I hope it has answered the questions that I was posted. Someone else answered, where am I and where am I from? As you saw, I filed in North Carolina. That was that PACER entry at the beginning. I am originally from Canada, so I had a Toronto sweatshirt on the other day. And I worked for IBM Canada for 19 years until 1997, and then I moved to the United States and joined IBM US. So there's going to be another episode on finding counsel and the quest for counsel, and I've had a couple of rounds of that. But towards the end of that, I actually got a chance to play with ChatGPT a little bit. This is with my son's help, and I'll go over that. But after going through a lot of detail of explaining what you just saw in those charts, he typed in, okay, help me explain this whole thing to a 5-year-old. So this is ChatGPT, and there's even a subreddit on explained by a 5-year-old, so I could do this. So here's what ChatGPT came back with as an explanation of what this whole suit is about. All right, let's imagine you have a big box of crayons. That's IBM. Every day you're allowed to use a few crayons, health benefits, to draw pictures. One day the person in charge of the crayons, IBM's management, decides to change the rules. Now they say you can only use certain colors unless you agree to use a smaller box that they chose for you. If you don't agree, you can't use any of the special crayons, those HRA funds, you were promised for being good at drawing. You feel this isn't fair because you were told that before you could use any crayons you wanted when you got older. So you decide to tell a teacher, the court, that the crayon rules should go back to how they were. You think the new rules aren't nice, especially to the older kids or retirees who have been drawing pictures for a very long time. Now you're looking at the school's rule book, that's like the ERISA laws, talking to other kids, other retirees, and legal experts to show the teacher why the new crayon rules aren't fair. You're hoping the teacher will understand and help make things right so everyone can use their crayons happily again. So it's kind of like, can't we just go back to the way things were? And that's sort of the grandfather rule. So then he says, so what do I need to show the judge? To explain this to a 5-year-old, let's imagine you're trying to show the playground monitor, the judge, why the new rules about sharing toys, IBM's health benefits changes, aren't fair. Here's what you need to show. The rule book, which is the ERISA laws. The old rules and the new rules, and that's the 2 summary plan descriptions. Gosh, I've done that so far, all without having counsel on how to present the merits of my case. Your friends' stories, other retirees. Oh, those are comments to some of the blogs and newspaper articles that I've submitted. Fairness. Explain why you think the new rules aren't fair. Well, I think you've heard that in this episode. And what is it that I want? I could say I want my crayons back, but really I just want things for the group that's like me to basically get what they had before and not be punitively punished and discriminated against as IBM is doing now. So thank you once again for listening to my episode. I think the next one, that was what I had planned in this episode, is basically, I was going to call it acronym soup and same-day service at the EEOC, which was a surprise experience. So I hope you all have a happy new year, and we'll see that episode within a few days. Thank you for listening today.